So when something like October 1, the event happens, do you have to be a first responder or someone at the concert to be affected by it?
I would think that it would be very difficult to find someone who was not affected by it. It's not only anyone in the community, but even beyond, because people were here for the event and then traveled back to other places. There was so much media coverage, and it was such a large tragedy, it impacted so many people that were there, but there were people who knew somebody there, who worked with somebody who was there or had a family member there, worked there. It would be hard to find, I think, people who weren't affected.
Right. And we talk so much about the first responders. Angela, this is something, not everybody who responded that night is considered a first responder. Can you talk about that?
Do you mean as in the civilian heroes that helped out?
Civilian heroes, but also some of even the 911 calls.
Yeah, and I consider them our first responders. They're the ones who take the initial calls. So they're the ones that initially knew something was going on. They had to notify the hospitals and put them on alert that something's happening. They had to try to figure out what was going on so they knew where to send people that were calling in. People were calling with their friends who just got shot, loved one who just got shot, and they had to try to figure out where safety was. Because at that moment, no one knew. At one point, we thought there were multiple shooters. So no one knew where that safety point was, so it was hard to tell people where to go.
Are they considered first responders?
They're not technically. Like, I think they're categorized, I don't want to say this wrong, so don't quote me on it, but I think they're in like almost an administrative position, categorized, but they really truly are first responders. You know, but when they get a call, they're the ones who start CPR before the crews even get there. You know, so they're out there saving lives, but they're just that voice saving lives, so people often forget about them.
Chris, tell me a little bit about the impact at your Desert Springs. Tell me a little bit about the impact there, just within the people. Many responded.
For sure.
People came to your hospital.
We took a large portion of those patients, either via EMS or people brought them in their own personal vehicles and things like that. I think Desert Springs is not a trauma hospital, but for about 8 hours we became one. And so just based on the level and the acuity of the folks that came in, we pulled nurses from our critical care floors, we pulled our med-surg nurses, we sent down even some of our nurses from our psychiatric floor just to work as task nurses. So we had a lot of staff that were there, even our administration was down comforting people and handing out blankets. And so you have a lot of the people that aren't pre-exposed or used to trauma that are going through this scenario that really just, they had no idea what they're walking into. We've still, even ongoing, we have employees, medical professionals that struggle with it, either can't return to work or continue to come to myself or ask for resources for other professionals to get some sort of closure. We have a lot of people that are just kind of waiting. You know, it's going to be okay, I'm going to wait it out. And I think a lot of people, I don't think that's specific just to first responders. I think it's really going to be the case for a lot of people, unfortunately.
What would you say are the signs of someone who is struggling, since it is so widespread and we all know someone who knows someone, some of us closer than others? What are those signs? What should we be looking for?
So I mean, if you're looking strictly down the PTSD sort of guidelines, you're looking for, I mean, I think stereotypically it's, you know, flashbacks and bad dreams of the incident. And I think that's the one that if we don't see that, we don't really think a lot is going on. But there are issues like chronic pain is actually one of the precursors to PTSD. There's a lot of avoidance, what we call a hyperstartle response, so somebody jumps to a noise or things like that. Sort of the difficult part with PTSD is that there are so many different types of triggers for it, and they're so small, there's no way to say, here's X, Y, and Z to do to prevent it. It can be anything associated with any of the senses. So you hear a song that was played, not even that night, but by that artist, a smell of food that was cooking in the background, the smell of grass. I mean, it can be any number of things that just out of the blue can kind of trigger it.
Wow. Is that something that you've experienced at Las Vegas Fire in terms of the first responders that were there that night coming saying, I need some time off, there are some triggers, it's getting too difficult to work?
Well, I think it's almost the opposite. I think it's what you were speaking to. People want to just move on and past it, even though it's not going to go away. You know, so they try to jump right back in it. I mean, but for a lot of our folks, I mean, we live in Las Vegas, so we have a lot of gunshot wounds on a daily basis. That's not a normal call anymore. You know, that used to be an ordinary call for these guys, and now it's not. You know, things like that I've noticed have started to change a little bit. But as far as people trying to call off, it's usually the opposite. You know, for fire, military, police, all of us want to just suck it up and soldier on and pretend like nothing's wrong. You know, where in the meantime, you know, they're suffering. So for us, one of the things, and actually probably any community member, when you start isolating yourself, you will notice sick hours going up, but they're not going to associate it with this event. But you, as a friend, as a supervisor, as a peer, you notice people coming in late. You might notice them looking more tired. They're withdrawn a little bit, not talking as much. For our department specifically, not hanging out at the kitchen table anymore. After calls, you're going straight to your bunk instead of hanging out with the crew. Those are all things to look for. You know,
and avoidance, I think, is probably a way to summarize it. So people that avoid things that I used to do, I used to be this great concert goer. It was one of the things I loved doing with friends or family. And I avoid anything remotely. I'm not going to go to the gun range. I'm not going to go to a concert. I'm not going to go to a restaurant that's nearby, or things like that is super common.
So what's the opportunity for us? Because you can't avoid it because it's going to come back, is what I'm hearing at some point. What can we do?
As community members?
As a community member, not experts, but what can we do? Do you bring it up? Do you say, what's the proper way to, I don't know, kind of broach the subject? Are you okay?
I think you're looking for changes in that person, something, you know, maybe they're doing things differently than they used to do. Maybe they were very outgoing and now they're withdrawn, because everyone's response is so individualized.
Right.
And so I think it is okay to say, I've noticed that, you know, or I'm wondering if, you know, this is going on. And trying to get some communication and some awareness. You know, I see chatter on Facebook of people saying, you know, I want to go to a concert again and I'm gearing myself up and here's the things I'm doing to get ready, and other people saying, you know, I've tried this, and, you know, so they are supporting each other, but also recognizing when it's a big change for somebody, then you might want to talk to them about, can I help you go find someone else to talk to, or to do something to address it. And I think it is okay to bring it up. I think you have to.
And I also think one of the biggest things we need to remember, we were talking about it earlier, is even if you weren't there, you could still be affected. And we try to pretend, well, I should be okay because I didn't get shot at, I should be fine. It's okay not to be okay, and it's okay to reach out for help even if you weren't at that concert. That event threatened the security of all of us who live here. Right. And people who live in any city, really anywhere. It made it real that can happen in this community. So whether you were there or not, it's okay if you're affected, and it's okay if you need to go out and get help.
And I think that's one of the important things that we're talking about. What do we do as a community? And for me, I think there's a couple of things. The first one is we have to be patient, because we have yet to see the worst of the effects of this.
Explain that.
So PTSD doesn't always initially happen right at the time of an event. Typically, it's an average of about 3 months post-event that the symptoms really start coming out. It can take years for that to happen, though. So although we're 9 months out or however far out, we're actually just in the very beginning stages of this. And so when we say, well, we want to help the people that were impacted by it, and we want to help their families. One of the things I would say is let's be careful that we're going to help them the right way.
Right.
So in instances with, say, grief and loss or with trauma, the reactions are very similar. Somebody will say, Angela's a good friend of mine, and I see her upset or struggling. My initial reaction or inclination is everything's going to be okay, I'm going to help her, I'm going to fix her, because it relieves my own anxiety about watching somebody I care about that way. So realistically, we need to be patient, and the best thing you can do is let somebody feel bad, let somebody struggle. They have to go through it. It's uncomfortable and it doesn't look great, and it's really heartbreaking, but that's really one of the most therapeutic things we do.
There's no preventative action. Someone who was at the event, was a first responder, there's nothing, if they're not exhibiting any symptoms, there's nothing preventative that they can do?
For a victim?
For a victim or first responder?
The most therapeutic or most healing thing a victim can do is to talk about it. That's for PTSD, the treatment of PTSD is talk therapy and medications. The interesting thing is that the medications given for PTSD are typically antidepressants and then medications for anxiety. Depression is also one of those things we really struggle to talk about. It's kind of like if I don't have an explanation for the way I'm feeling, and people that start developing these symptoms want to explain it as something else. Oh, I've got a headache, and headaches are really common in PTSD as precursor to symptom manifestation. So just being able to kind of, I'm going to talk about it, the more you talk about it, the more you're just going to do it in intervals. Hey, this is as far as I'm comfortable with, and as community members or family members or friends of those people that went through that, what we have to make sure is we're not pushing for the story. We're just being the outlet for what they need us, and then we're just supportive. You know what, I'm sorry, I can't imagine what that had been like.
Okay.
And the way it was always explained to me is basically the more you talk about it, the less power and emotion is attached. So that's why right after events like that, within 48 to 72 hours, if voluntarily, obviously, but we'll do debriefings and diffusings to give people the opportunity to talk about it and kind of start there to help remove some of that power. And on the flip side, some people will be okay, and that's okay too.
Right.
You know, if you feel okay, that's okay too.
Right.
So we had a lot of people feeling guilty because they didn't feel bad. Not bad, I mean, they felt bad about the incident, but they weren't exhibiting those symptoms, so then they thought something was wrong with them because they weren't. And we're all telling them, you should be, this is going to happen, this is going to happen. When it didn't happen, they're like, what's wrong with me? That stuff's not happening. It's okay too.
Right.
Everyone's going to react differently.
And that's what we keep hearing, is that it's different for everyone. We're coming up on the 1-year anniversary. I wanted to talk a little bit about triggers. Just because it seems on a regular basis we're seeing the release of maybe body cam video from officers that were there, first responders, and it seems to be happening a lot. It's hard to escape sometimes. It's on television, newspaper, radio, social media. I see it there. Those have got to be triggers for folks.
They are, I think, for sure. And like I said, anything that is even remotely related, just like I see a beer sign and I remember a beer cart I was standing next to at the time, can be something so simple as that. And so as this type of thing comes up or becomes more prevalent, that's one of the things we really have to be attentive to, and we're not going to control those things. We're not. Yeah. But we just need to be patient as they come up and at least be cognizant of the things we want to look for.
And knowing what you said about the fact that PTSD, much of that, it's going to start generally 3 months after the event and will continue on for however long, depending on the person. What should we be thinking about as the 1-year anniversary comes up? Are there special things we should be anticipating? Are there special steps that are going to be taken to help people address this? I don't know.
Well, I think we do know from other events and from the research that any reminding event, it can be the birthday of the person, it can be the anniversary of the event or the 1-year mark, is a time when people are going to possibly have a stronger reaction or find themselves kind of back in that moment which even though they know they're not in that moment,
Right.
their body is feeling as if they're in that moment. And so, again, I think you said it well in terms of patience, just being present, being able to tolerate that someone you care about is in pain is a difficult thing. And also everybody's in a different place. There are actually some people who are in a very good place right now, who've done a lot of work to heal. And there are some people who haven't even begun the work yet. And so just being aware and understanding and knowing and seeing it in ourselves, taking care of ourselves so that we can help take care of other people.
I know when Angela, you'd spoken of some of the changes that happened in another state after, I believe, Florida, after
Right,
the
after
Orlando shooting. As it stands now, and I don't know that people understand this, something like workers' comp, you fall off a ladder, you get help. Something like this, again, it's not tangible so much, mental health issues. Workers' comp is not going to help most of these people. I mean, I think there's a 3-month window in there, first of all, but it doesn't cover this kind of stuff.
It doesn't unless you were directly there when the shooting was happening. Like if your life was directly in danger, then you can make a case. And it has to be filed within 3 months.
So we're past that.
Right. So that is something we need to change. It was after the Parkland shooting when Florida's legislation changed, and we know ours doesn't meet annually.
Right.
So hopefully with the next legislation meeting, we can push something like that through so we can make sure that people are getting the help and care they need.
Right.
We treat the mental health side of workers' comp is no different than the physical side. So you still have the 90 days as you would if it was a broken foot or a bad back.
Right.
But we know it's different. The duration's different. Like you said, the onset's different. There is such a thing called late onset PTSD. So there's all these other factors that we have to consider when we're looking at this. So hopefully we can get that changed. I mean, that's the goal. It's going to affect more than first responders. It'll affect the people that were working in the vendors, the hotel staff, everyone that was out there. So we need to push for that.
Just the unique aspect of first responders in that they're faced with sometimes these, not the October 1 event, but they're faced with shootings and every single day. So it really is kind of a unique, helping them recover is different.
And that's another thing workers' comp doesn't address is the cumulative effect of trauma. That's not in there. It has to be isolated incident. So for like the police officers, all the EMS crews out there, fire crews, they experience trauma every single day. This was just like a cap. And then after this incident, they still took calls at night. I mean, it's not like the calls stopped. Once the incident was, I don't want to say over because it's still not over, but once our role in the incident that evening was over, they were still taking more calls.
Right.
I mean, we still had children drownings, we still had gunshot wounds, we still had everything else just kept going on, and that's daily life.
So how do you reach those folks if they're going to, as you said earlier, if their avoidance is kind of high? I'm a professional here, this is my job, I'm not going to talk about it. How do you reach those folks to help them get the treatment they need?
What we're working on right now is just making a huge culture shift in the first responder world.
Yeah.
And it starts with the International Association for Firefighters. They're supporting behavioral health issues now. For this event, for the anniversary, we are bringing the dog teams back in. I don't know if you have much experience with therapy dogs, but it's phenomenal the way people open up when the dogs are present. And just making it safe for them to know that if they go get help, their job's not going to be in jeopardy. They're not going to lose any, they're still going to be credible, they're still going to be respected. It's okay. And that has to start from the top. And our chief has been really good and supportive about that. I know Chief Castle's been really supportive about that. Just starting at the top and letting people know it's okay to get help. But it's going to take a cultural shift.
It's a mindset
It
among
is.
those folks. It's like, I'm going to be strong, this is my job, I got to handle it. But it's really changing that mindset.
That's exactly what it is, because they do feel like it's my job, I should be able to handle it, I shouldn't need help because it's my job.
Well, I think it's part of that shift is understanding, you take care of your equipment, you take care of your physical wellness, that has to all be working and in good shape, and so does, the psychological aspect. It's got to be working for everything else to work.
One big thing that we're doing, I think you were doing it at the at social services too, is building the peer support team, because there's so much evidence to support that peer-to-peer support is one of the most effective kind of support you can provide.
Right.
So we're building our peer support team, so they know they can talk to someone else who has that understanding of what they're going through, and that person saying, you know what, it's okay if you get help. I got help, you know, and they're standing up and letting people know that. That's huge. That makes a huge difference. So we think we're up to 42 people now, and I gotta say this right now. There's no way. I think for me personally, I could have made it to this event without the peer support team. I mean, they were wonderful. Some of our folks over in Help Metro reach out to some of their officers. It's just a whole valley effort, and it's amazing how we all come together. You know. Okay.
You know, knowing that so many of these aspects are yet to happen for a lot of the folks, I guess we need to find out about the resources. I keep hearing that mental health resources, there's not a lot of that to go around. Am I wrong?
No, that's true. And Nevada's been in a sort of mental health professional shortage for years and years now. And I think it's gotten a little bit better as over the last few years, they've increased the disciplines of therapists that they're bringing in. But I think realistically, number one, there's a shortage. Number two, there's sort of what we've talked about before, the stigma of going in and talking. It's that first initial session. So in my office, people come in and they'll sit down, and you know, one of the first things I address, you know, it took a lot for you to come in. Things must be real bad because I know how hard it is for you to come in and talk to me.
Right.
And as soon as we can kind of, as a community, lower that tension or anxiety about going in, it's okay to ask for some help a little bit. Then I do think we'll see more of it on the clinical end, but as far as providers and programs and stuff, I think that's still just newly trying to be developed to address this, even though it's been a statewide issue for quite some time.
Right.
And I think Terri could probably speak to this a little better, but the issue we were running into was finding trauma-trained counselors. That was the biggest issue. So we're flooding, all our organizations are flooding the same counselors because there weren't very many in the town. Yeah.
Is that the issue? Is it people that have experience in dealing with this kind of trauma?
I think that, you know, it is important for anyone seeking help to get the counselor that works best for them, and there is you know, specific training in trauma and working with this type of an incident, working with people who've experienced this kind of an incident, working with first responders. There are a lot of, the mental health community really did step up, and many people came forward and put in a lot of effort, and those therapists that are specially trained are putting in overtime and working pro bono at times, and really doing everything they can to help the community. Just like any we can always use more. Right. And this has brought an awareness of the need for additional specialized training, and there are efforts in the community to bring that about, to make that happen, to increase peer support for first responders, and to increase the amount of training available so we can have more clinicians who have the specialization needed.
What would you say is the need at the Vegas Resiliency Center? I know you've got counselors there for walk-in and you're taking appointments, and it may not be counseling, but what is the need?
Primarily the Vegas Strong Resiliency Center is a referral and resource hub, so people can call and they can walk in, and the persons who they talk with will help understand their own situation and exactly what they do need. So it may be to apply for victims of crime benefits. It may be to get a referral to counseling or some other type of service. We also have Metro's Victims Advocate program is there, Clark County Social Services is there, Legal Aid is there, and there have been a lot of, they've been very active and very helpful to a lot of people. So it's really trying to match it to the person calling. The other thing that we are hoping for people to contact the center is so we can learn more about what is it that the community needs, and we only know that by having contact with those people. And so we are encouraging anyone to contact us, even if it's to say that they've noticed a need or here's something they need that hasn't been met yet, and then maybe we can find a way to meet that need.
Are there still places that are offering free counseling?
Yes. Okay. I think that's probably, you know, winding down, and we are looking for for paying sources and insurance and that kind of thing. But I don't know that anyone's that's already involved in counseling, you know, they're not being turned away, and I don't know that people are being turned away based on payment.
Okay. I guess I would ask now, maybe final thoughts. Whatever issue, you know, sounds like people that come into the Resiliency Center, sounds like right now you have a way to connect them with a resource. There's no glaring missing item. But what would your final thought be in terms of, as we look at this issue and look at it in the coming months?
Well, I think one of the important things is that not all of the wounds caused by a mass shooting come from gunshots. And you know, we need to be prepared that this is a long road. This is not by any means over, as you said. And we know from looking at other communities where there have been incidents that there's 1 year, there's 2 years, there's 5 years, and the needs will continue. So I think the more we learn from what we've experienced and the more we can add to our community's ability to respond, the better. And again, that takes hearing from people about what they do need and what has worked. You know, what's out there that's been the most benefit, and what do they still need?
I would say, I mean, for me, and we talked a little bit about, well, what do we do as a community? And part of that push is the sense of helplessness that we all feel when something this big happens. And I think, like, if I had the opportunity to just kind of sit down eye to eye with every community member in Las Vegas, the thing I would say is we didn't stop needing heroes at 8 o'clock in the morning on October 2nd. We didn't stop needing them when the emergency rooms were cleaned up and the sirens quieted down. We still need a whole bunch of them. And if there's really something that they want to do and you want to still be a hero, be kind to every person all the time, every day, even if they don't deserve it.
That's hard to follow.
Yeah.
That's a good message. Like, I forgot what I was going to say. Honestly, a couple things. First and foremost, we have to take care of ourselves in order to take care of each other. If you are someone out there who needs some support and maybe you're not ready to seek counseling, I encourage people to educate themselves. And there are a lot of self-help resources out there that you can start with if you don't feel you're ready to go into someone's office. You know, if you just Google self-help for PTSD, Google mindfulness, guided imagery, there's all sorts of stuff you can do if you're not ready to take that step. And I honestly completely forgot what I was going to say because I was actually really moved by what you said. Because I'm very proud of this community and the way it came together. I'm proud of the way we've all bonded, supported each other, and I'm with you. I'd like to see that continue. It's not just 1 October, you know.
Okay. Appreciate your time.
Thank you.
All of you.
Thank you.